This year alone, doctors in the United States are expected to diagnose more than 2 million new cancer cases. It's according to the American Cancer Society. However, cancer death rates continue to decline, thanks in part to earlier detection for certain types of the disease. However, screenings for cervical cancer remain low across the country. Tonight, Jeremiah Jacobson looks at the troubling trend.
First, the good news. Newly released research shows screenings for both colorectal and breast cancers have rebounded from declines during the COVID-19 pandemic. But researchers say that has not been the case for another cancer.
And unfortunately, we didn't see that for cervical cancer screening, that they are still below pre-pandemic level.
Study senior author Preeti Bondi and her team found past year cervical cancer screening in 2023 remained at 14%, which is below pre-pandemic levels.
We want to detect cancers early when they're more treatable.
And that's why researchers say it's a troubling trend, one that's viewed as a long-term problem, as cervical cancer screening started to decline in the early 2000s. It still isn't fully clear why these specific screenings haven't bounced back like others post-pandemic.
Some of the research points to reducing knowledge among women about the need for cervical cancer screening and fewer recommendations to be screened by physicians.
Cervical cancer screening recommendations vary based on age and health, but the United States Preventive Services Task Force says if your age is 21 to 29, get your first Pap test at 21 and every 3 years after. If your age is 30 to 65, there are options. Get tested for human papillomavirus, which can cause cervical cancer, every 5 years, or an HPV Pap co-test every 5 years, or a Pap test every 3 years.
The American Cancer Society recommends that women start cervical cancer screenings at age 25 and take an HPV test. They say the HPV test should be repeated every 5 years through the age of 65.